So what we're going to do now, we're going to go into the room and we're going to receive the call together. Let's go.
The Commission on Magnet has reviewed all of your submitted documentation and findings from your site visit. As a result of our review, it's really my honor and a privilege to officially notify you that the Commission on Magnet has unanimously voted to credential Children's Healthcare of Atlanta at Egleston at the Magnet organization. Your initial designation. Congratulations.
I think we're good. Thank you.
So while the Commission was reviewing the observations made by your appraisal team, we have identified that you have 5 exemplars.
Sorry, we're a little loud.
That's right. Let me tell you which ones they are. The first exemplar is TL4A, which is, actually we're talking about you, Linda, in this one. This is the CNO's involvement in the organization's decision making. And this is related to the work that you led. And it seems like a significant number of people were involved in your work related to your helicopter program. Not only getting a new helicopter, but the space. And the work that you did, even on this program called the Parkboard Hospital, which was a designed facility in a warehouse. So that's exemplar 1, so congratulations.
Thank you.
Thank you. The second exemplar is EP1A, which is the development of the nursing professional practice model and involvement of clinical nurses. The appraisal team really enjoyed learning, as did the Commission, learning about your night owl program. Yeah, I loved reading about your healthy work environment activities and all, especially the numerous outcomes that were cited, and Night Owl Awards to facilitate further recognition and retention of the night shift nursing staff. So congratulations on the second exemplar. The next exemplar is EP3EOB, which is national benchmarking data related to your nurse satisfaction data. And in your organization, the unit level data for nurse satisfaction outperforms the vendor's national mean for the 4 selected categories on 20 of your 26 units. An outperformance of almost 77%. So congratulations on that. The next exemplar is EP4B, which is related to nurses partnering with patients and families to improve care. And this particular one is related to the psychosocial well-being and support in the system you develop for your patients with acute myeloid leukemia, including your patients who underwent bone marrow transplant. As I understand it, several of your nurses, Lee McManus, Ann Liston Wells, Melissa Thomas, Michelle Dye, created a proposal to offer increased hours of respite care to this patient population. And they partnered with your volunteer department and really created a wonderful program where your families are provided significant respite care. So I would say congratulations to you on this wonderful exemplar. And your next exemplar is NK4EOA, and that's an improvement that resulted from an innovation in nursing. And this exemplar is related to children with autism spectrum disorder. This was very creative, innovative work where the appraisal team noted examples of innovation at the unit level with nurses and other disciplines working and creating a paper-based copying plan and in a template that you have used for surgical encounters with children of autism. And that really is a coping plan that helps others to understand the needs of people with autism. And I would say congratulations on that particular very important work as well. I'm going to end by saying I'm going to hope that I get to meet all of you in Orlando at the next Magnet Conference in October. And really, when your organization will be formally recognized. So I want to conclude so that you can have your party. Yeah. Children's Healthcare of Atlanta is joining 7 magnet organizations in Georgia. And I think you all know that this accomplishment is a testament to your commitment to not only nursing excellence, but your dedication to your patients and families and to each other. So I want to end by saying job well done. Looking forward to seeing you again in Orlando, and very best wishes to all of you.
Well, thank you, Dr. Erickson, and I just want to thank you and all the members of the Commission on Magnet for providing this wonderful news that we received today. I also want to thank our current and former senior program analyst, Victoria Wooden and Cynthia Coyle, and our Magnet program specialist, Becky Matthews. Your support throughout this entire journey has been so appreciated, and we could not have done it without you. Of course, we couldn't have done it without the phenomenal nursing and support team that we have at Children's, and I could not be more proud to be a part of the team. And I made it through the call without crying. So thank
you. Those are well-deserved tears. Thank you.
Thank you.
Thank you so much. Enjoy. Yes. Bye-bye.
Bye-bye. Well, guys, thank you. I don't have a lot of prepared words for this, but I don't know how to put how I feel into words. Can you hear me now? Guys, thank you so much. As you know, this is not about me. It is about us. And as I said, I could not be more proud to be associated with the team than this nursing and all the support departments that have come together to support us. It is truly a pinnacle in your career to be able to stand here before you because you are such phenomenal players. I just cannot be more proud. And one thing that I don't know that all of you know is 5 exemplars is very unusual. There are very few exemplars being given out when you get toward that a remake or a
designation.
Yeah, or the manual gets updated. So that we received 5, but as you heard what those were all hard work done throughout the system. So I don't know how to put into words how I feel, so all I'm going to say is thank you, and I am going to turn it over to Mary Beth.
Where are all my folks who have been here since 2007? Please stand. You are the creators of the flame, the staff who knew what we were and what we had. They have protected and maintained the flame for others to see. They have shared what the flame meant and told the folks that came after them all of the stories. Where are my folks who are greater than 5 years but were not here in 2007? Please stand. You are the dreamers and the believers. You listened to the keepers of the flame and helped build the foundation that allowed the keepers to place the flame in a safe place. The believers were involved in choice and can. They helped the quality program move forward. They raised the bar. They got certified. They encouraged others to do the same. They realized that physicians are our partners, and they cultivated the relationships to allow us to do what we have done. Where are my less than 5-year folks? Please stand. This is the team that are the doers. They watched the keepers of the flame and the believers. They listened. They embraced and strengthened my path and shared decision-making. They became safety coaches and drove down BSIs, PUPs, UTIs, falls. They embraced patient experience. They placed our NDNQI into the green. They fanned the flame. It's doing so well. The Magnet Award belongs to all of you. Wear it proudly. Place it next to the steady flame that the creators built. Protect them both for generations to come. Congratulations.
That is tough to follow. I don't have much to say, but I did want to say that to me, today Magnet means deserving. When I started here, my career in 2012 at Children's, and I met with the nurses and all the leaders and the care delivery partners, I felt their passion for the children of Georgia and the region and parents and families and their passion to get Magnet. And the competition side of me was like, we will get Magnet. Your leaders have all known for a long time that you're Magnet. You are all rock stars, and you have earned Magnet. And today, the world knows that we are Magnet. The nurses and the care delivery partners, you are all MVP quarterbacks, and today is our Super Bowl. So congratulations, let the party begin. Yeah.
I don't normally write things down, but I thought I'd be an emotional basket case today, so I did. So how good does this feel? Does this feel pretty darn good? All of you. One thing, if you take one thing away from this moment, it's that it's a reminder that what we do here is not normal. You are not normal. You are extraordinary. That is huge. That is one thing we really took away from this Magnet journey and site visit, is that you are extraordinary. Extraordinary. Whether you're parking cars, whether you're doing brain surgery, whether you're committing to sit with your families, whether you're cleaning rooms or delivering food, every single person who steps into this facility is extraordinary, and Magnet gives us the opportunity to celebrate that. So, congratulations. We also just made children's history. Does that feel pretty good? Yes. So there is a long list of people that I do want to take a minute to thank. I won't be able to get to every single person by name, but we as a real core team do appreciate all of the hard work that everyone's put into this journey. I wanted to start by thanking our nurses. This designation is for you. You are the reason we are sitting at this table right now. You are extraordinary, you are special, and you deserve to be celebrated. You truly make the difference in the lives of our children every single day. You are truly the inspiration that has kept me going, because this has been a really wonderful but challenging 3 years. So thank you. Someone said a year ago, I think it was Karina, had mentioned, I drank the Magnet juice. She was referring to herself. And all of you have drank the Magnet juice, and we have some today out in the reception that I want you guys to drink. To our care delivery partners and our administrative support partners, to all the departments that have really supported this journey, thank you for collaborating with us, supporting us, challenging us, and achieving greatness and excellence with us. We really do appreciate your willingness to partner with us throughout these 3 years. To our Magnet ambassadors, Magnet writers, Magnet champions, clinical nurse guides, shared leadership members, thank you for your continued dedication and support of our journey. You have all held very different but very critical roles in this 3-year process, and we could not have done it without you. It has been truly inspirational to watch you all transform over the last 3 years. So thank you. To our executive leaders, some of whom are here, some of who are not here. Donna Highland is not here today. She will hopefully be here for the reception. Thank you for supporting us. Thank you for removing barriers when it was necessary. Thank you for financially supporting this journey. It has not been a cheap one. And thank you for creating Melanized positions. That we did not have in place for our past 2 designations, and I do think that they were all critical to our success. To my work family, to Melanie, to Larissa, to Gail, to Holly, who's out in the Caribbean somewhere watching this Facebook Live, to Megan, our quality data specialist, and to many others in the room today. This has been such an amazing ride, and we couldn't have imagined doing it without each and every one of you. So thank you, thank you. To my real family, some of you who are here today, and my parents who are on Facebook Live, thank you for listening to me talk about Magnet, cry about Magnet, laugh about Magnet, celebrate Magnet. Especially to my husband, thank you for supporting me to be a working mom with 3 little small ones. This has been a challenge over the last 3 years, and also the most rewarding experience for me personally and professionally, and I very much appreciate you. And to the 2 most influential people who are sitting in this room today, I'm gonna lose it. Linda Cole and Mary Beth, you deserve this designation more than anyone. I thought 3 years was a long time, but y'all been waiting about 12. You must be exhausted. Mary Beth, I have to tell a funny story. Mary Beth, her password, I guess for the last 3 years has been something related to Magnet, like we are going to be Magnet 2018 or something. And so 4 days before we got the call, she kept texting me, she's like, I'm gonna have to change my password in 4 days. Like, we have got to get this call. So, now Mary Beth's password.
Elena, don't listen.
She said that she's already changed it, but we are Magnet 2018 together. Mary Beth's bucket list to achieve before she retires. So don't ever retire, but you are allowed to. And Linda Cole, your leadership has carried us truly to this moment. You are the most passionate advocate for us, that's nursing and beyond, and words do not express how deeply we appreciate all that you have done to ensure that we are extraordinary and excellent. And for all of you, this designation is for us. We, everyone in this room today, are the reason that Georgia's kids are better today and healthier tomorrow. Thank you for helping us serve our mission. Congratulations!
Okay, I know you're all anxious to get out there and get the Magnet juice and the lovely refreshments, but I could not let you leave. We'd be remiss if we didn't give one more huge round of applause to Kristen for everything.
Oh, I do want to say one more thing. So there's some symbolism behind these little bottle jars here. So for those of you who went through training, our training guidebooks that were left over, we had shredded. You know you will always remember this because of the training guidebooks. They're shredded, and we really want everyone to bottle up this moment, really take it all in. So open up the top of your jar, take this moment in, and set it somewhere where you can always look at it. Y'all, I'm truly telling you, the site visit was 8 weeks ago. Like, we've already forgotten what that feels like, and I do not want you to forget this moment. Like, this is a moment that we should always remember. And next week, we're going to be already on to the next big thing. Scottish Rite, by the way. Scottish Rite. So please take a moment to grab one of these on your way out. And we do have wonderful reception in the back. We have Magnet juice. We also have lots of good desserts. And wonderful goodies. So thank you all very, very much for being here today.
Magnet is spiked. It's all the same stuff.
Should be.
Holly's on.